The following segment is sponsored by Coastal Fertility Specialists. National Infertility Awareness Week is coming up, and we continue to shine the light on infertility with Coastal Fertility Specialists. Right now we have Dr. Jessica McLaughlin to tell us more about the practice and egg freezing. Thank you for having us.
Oh, so happy to be here. Thank you.
Yes, we're going to continue to go behind the scenes and learn more about what it is that you guys do. First of all, tell me a little bit about the practice.
So Coastal Fertility has been around since 2012, and we have 5 regional locations to try to be most convenient for patients. But we are all about making patients' dreams come true. What we really pride ourselves on is top level, top notch medical care, but that is really coupled with compassion and kindness.
Right, you guys do amazing things here, and what we want to touch on today, I know it's been in the media a lot, egg freezing. What exactly does this mean? How does this work?
Egg freezing is really kind of just what it sounds like, the ability to freeze or cryopreserve a woman's eggs. And what that entails is that woman actually undergoes an IVF cycle. So we are able to stimulate the ovaries, we are able to retrieve eggs, and then those eggs are frozen and remain frozen. So for example, if a patient underwent an egg freezing cycle at age 30, then she would have frozen eggs that will always be age 30.
Wow.
And so when she wants to use those in the future, maybe that is 8 or 10 years later, those are embryos created from a 30-year-old egg.
And you have a lot of experience with egg freezing.
That's right, and for egg freezing, experience really matters. So egg freezing is actually a technically challenging process, as compared to freezing embryos or freezing sperm. Eggs are actually harder to freeze. And so here at Coastal Fertility, we are the largest egg freezing program in the state, and we are one of 16 in the country that have really an egg freeze seal of assurance. And so we are very proud of our egg freezing experience. And as a patient, I would encourage you to look for a practice that has a lot of experience with egg freezing.
Right, so who is a good candidate? I'm envisioning someone who maybe your biological clock is ticking, right, but you don't have the right partner, so they might come to you and say, like, I want to save this for later, essentially.
So this technology was created really first for patients that were undergoing cancer treatments, because the cancer treatments really are hurtful to ovaries. So that's how this all developed. But now really anybody can freeze their eggs. So if you are desiring to delay childbearing for whatever reason that is, that's a great candidate to freeze eggs. And probably the optimal age is somewhere between 30 to 37 or so. Okay. So some younger women can freeze eggs. Maybe they have a history of early menopause, or they know they have a low egg count. Older women can also freeze eggs, but we know that the quantity and quality of eggs go down with time, and that's what happens with aging. So sometimes those stimulations are a little bit more variable, and sometimes it takes more eggs to have a reasonable chance for pregnancy in the future.
So really we're preserving fertility at that perfect age.
Exactly.
How long can the eggs stay frozen before they can come back to you and say, now I'm ready?
Yeah, really indefinitely. So technology's really advanced. We do something called vitrification now, which is a fancy word for how we freeze the eggs. But with this technology, really the eggs can stay frozen really indefinitely. So whenever you're ready, whenever's the right time in your life.
It is so amazing what we can do. For someone who's interested in this or wants to find out more, what's the first step to contact you guys?
Yeah, just contacting us, our new patient coordinators, to make an appointment. That can either be online or by calling our main office number. I think having a child's really important to women, and I think the reproductive aging is poorly understood. And so just having a conversation with a trusted doctor is a great place to start.
And how rewarding for you.
Oh, I love this job. We are so blessed.
It's got to be amazing. Thank you. It's been such a pleasure meeting you.
Thank you so much.
Thank you, Coastal Fertility Specialist. We're here at the Mount Pleasant location, but you have locations, all over the Low Country. And we're going to continue this series of shining the light on infertility. Right now, though, we've got to take a break. We've got more Low Country Live right after this.